Now, it's the Dr. Don Show. It's your health, it's your life on the Astral Radio Network. Now, here's Dr. Don.
Good evening, listeners. Welcome to the Dr. Don Show live on AM 650. We hope you're going to enjoy tuning into the show each and every Monday at 6 p.m. That's right, 6 p.m. Put it on your reminder list. Bring it up on your iPhone. Put it on your calendar. The show is all about you and your health each week. After all, it is your health, but more important, your life. And we're here to help you become an empowered healthcare consumer. Just like you know where you want to have a meal, where you're going to shop for your food or your car, we want you to become more knowledgeable about your body, more knowledgeable about the health professions that are there to serve you, and I stress serve you, and the outcomes of healthcare that you need to know more about. You need to have that knowledge, and we want you to be an empowered consumer so that when you pick up the phone, if you still have one of those, or dial on your iPhone or your remote, you know who you're calling, why, and what's going to happen. I'm Dr. Don Nixdorf, chiropractor these past 30 years, executive director for the BC Chiropractors and College of Chiropractors. Welcoming tonight our producer, Adam Graham. How's dinner tonight, Adam? Good. And production assistant Michelle DeRosa, also in studio tonight on this Labor Day weekend. And as we celebrate Labor Day, I want to give a serious congratulations and recognition to the BC Federation of Labor and labor in general. I can speak for British Columbia, obviously. I've been in practice here long enough and working for the profession and in private practice. And I know that the labor movement has been a key part, even before I began my career in healthcare, in working for British Columbians, both union members and not, to making sure that the healthcare system is as good as it can be and strives to make it better. Whether it's occupational health and safety, whether it's the Ministry of Health, whether it's employers, whether it's the Worker and Safe BC, we also want to give recognition to labor's recognition that prevention and appropriate care of injured workers is being addressed. And to that extent, I think I want to just say thank you to the Federation of Labor and its representative, Mr. Jim St. Clair. Now, of course, having said that, let's not forget that it's also you, the public, that are out there. And there is a comment from a previous Ministry of Health Service plan that I think is notable. And it kind of goes like this. The greatest untapped resource in healthcare is the consumer. That's you, by the way. Well-informed patients get better care from their doctors and provide better care for themselves. The issue at hand is how to get the right information into the hands of the right person at the right time. And that, listeners, is what the Dr. Don Show, brought to you by BC's Chiropractors, is all about. We touched base last week on a topic that is always going on, and the topic of this, in this case, however, is private health care, always a source of debate. And over the last month, this debate is intensified, focusing around private health care. And we asked you last week what we thought of that idea, and a couple of callers gave us their thoughts on it. And I want you to keep this on the top of your mind. We may come back to it on this show, but we certainly will be doing it on subsequent shows as well. Because the debate about private health care, you have to step back and realize that what is being debated is primarily surgical intervention. That when you look at the services that are being debated, it's not just a visit for a flu or some fever or something like that. It's debate for services that are being provided on surgery, whether it's at any of the private surgery centers, or more importantly, those same equivalent services that are found in hospitals. Now, ask yourself this question, and you need to put it in context exactly what you're debating and discussing. And that is very simple. If you were at home tonight and you needed some surgery because you either couldn't work or you couldn't function normally, or God forbid your life was at risk if this surgery wasn't going to occur, do you really want to have a debate on when that surgery is going to occur only around the question of when and who is paying for it? The debate is about who and when it's being paid for. So I throw that out for you to think about on tonight's show, and we're going to come back to this at later times because this issue is going to continue on for some time. It's also linked with what we referred to in our previous programs, and we'll touch again on future programs, and that's called the Health Accord 2014, which our guest tonight will also touch on a little bit in his personal experience. Anyway, those are some of the things that I think we want to acknowledge. And coming up on some of our future shows, let's not forget that, I think it's hard to not forget, and that we're going to have a provincial election next year. And as we've seen lately, that a lot of people that have served long and hard for public service have decided that their time has ended and they're not going to continue to, run for office anymore. So for the Liberal Party, this means an obvious change of people both in the party and becoming involved in the party. And when there's a change of people, there's often a change of policies as well. And it's no different for the NDP. They're going to be looking at candidates. We have the leader of the NDP, Adrian Dix. He used to be chief of staff for Glenn Clark. Well, I find it kind of interesting that things have reversed a little bit. Glenn Clark is in the private sector. And I would imagine that there still remains a cordial or other relationship between Adrian Dix and Glenn Clark. And with Mr. Clark's experience, both as premier and now in the private sector, working as he is, perhaps the influence on Mr. Dix and the NDP through a past premier of the NDP who has now got huge experience in the private sector, I have to think that maybe that's going to influence life in the future. So what do these two things have to do with this program? Everything. Everything. Because 42% of the provincial health budget is going to health care. 42%, and it keeps going up every year. And I describe that little financial fact as kind of like the Greek syndrome in the Eurozone. So more about that as we go on tonight and in future shows. Michelle, what are we going to do tonight on Labor Day?
Well, in addition to all that you've talked about, we hope that some callers call in and give us their opinions on those topics, we've got a great show lined up this week. The Massage Therapists Association of BC has brought us another guest this evening. Registered massage therapist Anders Lau will join us to discuss the benefits of massage therapy on your pain, and we'll also chat about vocal dysfunction. What is this exactly, and how can massage therapy benefit your voice or your speaking presentation? Plus, as Dr. Don mentioned, what do you think about the state of our healthcare system? It's really important that you weigh in on this and that you talk to your government representatives. So we want to hear your stories, your opinions, your experiences. Call us anytime in the hour. Local calls 604-280-0650. Out of town 1-877-280-0650, or if you're too shy, you can always send us an email. The email address is radio@bccairo.com.
Thanks, Michelle. Now, listeners, that email address we gave you, we understand that some of you would rather just send us the message. We get it right here in the studio. But importantly, apart from listening to us tonight, you can watch us. Yeah, how cool is that? So you want to see our guest tonight, Anders, and of course, Michelle, our production assistant. Adam, who's having dinner, you're not going to see, but that's okay. And of course, you're going to see your host, Dr. Don, here. So we are found at www.am650radio.com. am650radio.com. So send an email to your friends and family, wherever they are, up and down from Alaska to Mexico. And if you think they're still awake in Toronto, send them an email too, whether it's Toronto, Boston, or anywhere. And all they have to do is click on the AM650 TV link. There's an AM650 TV link that you will find at our website, am650radio.com. So tell them to, put down whatever they're doing, turn on the computer, turn the volume up on the speakers, and participate in the program tonight. Now, as we mentioned, we have Anders Lau, a member of the Registered Massage Therapy Association of British Columbia, join us tonight. And there's a chronic pain. There's enough to go around for everybody. So if you have questions tonight for our guest, Anders, we'll be pleased to take them at any time about any questions you have about contacting, care, payment, or anything associated with your health care. Anders will be pleased to answer that. So the numbers that Michelle gave you for Vancouver, 604-280-0650. Long distance toll free. We'd love to pay for this. 1-877-280-0650. Now, Anders is an exceptional guest tonight, and I usually don't go into the full bio of our guest, but I want you to listen carefully to Anders' clinical and professional experience, and you're going to find something in Anders' practice experience and his profession's participation in healthcare and what I'm about to read you. Anders Lau graduated from the West Coast College of Massage Therapy here in British Columbia in the summer of 2010. Since then, he has gone on to work in clinics all around the Lower Mainland, including Richmond, Vancouver, and New Westminster. He currently works in North Burnaby at Aurora Integrative Medical, New Westminster at Mountain Health and Wellness, and in Kitsilano at Peak Performance. The different clinics allow Anders to see patients of all kinds, from young adults involved in MVAs, better known as car crashes, to athletes competing well into their 60s. Anders, we'll talk later about that. An area of clinical practice that Anders hopes to continue building is in vocal dysfunction and health, and he's going to tell us a lot more about that. This fascination with massage therapy and the voice culminated in Anders selecting muscle tension dysphonia. Don't worry, we'll tell you what that is. Such as those held, as a subject for year-end research and case studies. Anders hopes to participate in other workshops for professionals, such as those held at the Pacific Voice Clinic. In addition, he hopes to effect preliminary research into massage therapy as a viable treatment for all voice users, such as singers, lawyers, and teachers. Lawyers? Well, Anders, we're definitely talking about that tonight. An avid singer from a young age, Anders himself has been a member of the Vancouver Bach Children's Organization since 1997 and performs with its premier group, Saraband. In addition, Anders' involvement with provincial organizations like the BC Choral Federation Youth Council, and the BC Youth Choir allowed him the chance to tour with the 2012 National Youth Choir in Ottawa. Now, in Anders' spare time, hard to believe that he has any, he is a participant in the sport of Brazilian Jiu-Jitsu, training under Don Whitefield's West Coast Martial Arts Group. The mindset of martial arts, combined with the physical demands of the grappling sport, allow for Anders to gain a unique insight into the body's movements, particularly under stress. That's something we all have. In addition, it makes for a great workout and personal goal for him. Anders, welcome to the show. I think I need to take a break.
Thank you very much for having us, and apologies for the break.
That's all right. We'll get to that. So, Anders, you've got such a huge, diverse career. You've only been in practice 2010. What were you thinking when you started massage therapy?
When I started massage therapy, my initial thought was that I was excited about having the chance to make a definitive effect, not only as a person that was really into massage, but a person that could provide massage therapy from a very unique perspective.
Well, that's incredible, because you launched yourself into your profession and service to the public in a huge way. And anybody in the health fields, just like politicians, it is service to the public. Let's be clear about that. Now, there's a number of things about massage therapy. Now, massage therapy is a regulated health profession like the other 25, 35, I've lost count, in British Columbia. Mm-hmm. And your college came under the Health Professions Act in 2009, just like medicine, dentistry, chiropractic, and all the other regulated health professions.
Absolutely.
What has your experience been with your profession since the college and the regulations came into play? Because everybody's felt a little bit of something as their college administrates their health providers.
It's a bit of an interesting situation, because we're relatively new as our own body, but we've existed since 1964.
Oh yes,
as part of the College of Massage Therapists and the College of Physiotherapists.
That's right.
And because of that, trying to accomplish dual goals of establishing yourself as your own profession, while at the same time helping every other province regulate, and helping every other province create their own identity as a massage therapy, as a practice,
right,
and as a profession. There's a lot of growing pains involved. There's a lot of differing opinions on how to enact these changes, and it makes for a very tensioned time.
I think I hear the song of a future candidate for president of the Massage Therapy Association of British Columbia. And before you get into trouble with your colleagues, I stress those are my words, not yours. So that's a disclaimer for you there. You're protected. So we're going to get into this fairly shortly here. How can massage therapy benefit you and your chronic pain? And we're going to have Anders explain some of that, as well as his other achievements. More with the registered massage therapist, Anders Lau. I'll get it right in just a moment. Remember, it's
There's
all
lots
about
more
your
still
health,
ahead.
your
This
life.
is the Astral Radio Network and the Dr. Don Show. It's your health, it's your life.